Wonderful. All right. Well, good afternoon, everyone. Thank you so much for joining Trust for America's Health this afternoon for another webinar in our series of age-friendly public health system trainings for our 6Cs framework that we're doing this year. My name is Megan Wolf. I'm the Senior Policy Development Manager at Trust for America's Health. And I just wanted to make sure that I acknowledge the wonderful partnership and very generous funding that we have with the John A. Hartford Foundation. They are an amazing funder and, as I said, great partners doing wonderful work across the country. So we really appreciate it. And I don't know if Jane, if you're able to get in, if you'd like to say something.
Well, thanks for letting me in. I somehow it wasn't there. But anyway, thank you so much, Megan. Oh, it's just such a privilege to get to work with Trust for America's Health on all of this work. And Megan, I love yours and Tifa's webinar series and Karan's webinar series, and I just can't wait to hear today. So thank you very much.
Thank you, Jane. We really appreciate your being here. I'm going to keep admitting people as we're talking. So let's go to the next slide, if you would, for me, Kalia. And so for those of you who aren't familiar with TIFA, we are a public health, we're a public health policy research and advocacy nonprofit dedicated to improving the conditions for health for every individual and every community. We do this through advancing evidence-based policy and advocating with a focus on equity, making disease prevention a national priority. And next slide, please. So as I said at the beginning when I was doing the introduction today, if we could go ahead and keep our devices on mute, we will have plenty of time to ask questions, we hope, at the end. And if you want to put your questions in the chat as we're moving along, that would be great. And as Jane did, if you'd like to introduce yourself in the chat function, we'd love to know who's here with us. And then for those of you who are participating in this event to become an AFPHS champion, receive that champion designation, we will be, this event is being recorded. And for those of you watching the recording, we'll have some instructions at the end. Next slide, please. So as I mentioned at the very beginning, this year, TIFA is focusing on our trainings on our 6Cs framework, which you see on the screen here. The 6Cs are tenets around this advancing health equity focus, but the tenets of the 6Cs tenets really provide an organizing function for public health to think about their roles in health. For example, creating and leading policy and systems changes is a category. When we think about that, that can be a public health practitioner leading the change to become an age-friendly community. Today, we're going to be focusing on coordinating. So coordinating existing supports and services. And we're going to hear from some speakers at a regional level and then at a very local level to hear about the work that they've been engaged in and participating in coordinating existing supports and services to promote and support older adult health and well-being. Next slide, please. And since our speakers today are from Region 10, which includes the state of Washington, and from the Benton Franklin Health District in Washington, I just wanted to give a quick update on the work that we have been doing through phase 2 of our work, which has come to a close. We're now moving into phase 3 of age-friendly public health systems. But our work with age-friendly public health with the Washington State Department of Health and with the local departments of health and AAAs in Washington also includes the Northwest Washington Indian Health Board, which is a 6-tribe consortium. And we're really excited about this work. It's the first opportunity we've had to work with tribal elders. We really appreciate, Barbara, your great work with the Northwest Washington Indian Health Board. And we're learning a lot, and we'll be able to report on that work a little bit later not today, but as we work through that process with them. We've also been bringing our ageism trainings to Washington. We've been helping to connect local health jurisdictions with AAAs and identifying areas where they can work together. And then the Washington State Department of Health has also been involved in creating an age-friendly Washington. So receiving that state level designation as an age and dementia friendly state. And so that's been really exciting for them to be part of that. There's just been some great partners and partnerships that have been strengthened through the work that we've been doing in Washington. So we're really, really proud of that work and pleased with it. Okay, next slide, please. And we'll get to our speakers. So really excited to have with us Louise Ryan. She is the Regional Administrator for HHS Region 10, representing the Administration for Community Living. And then we'll hear from Kelly Harnish and Kelly Lewis, who are from the Benton Franklin Health District, one of the local health jurisdictions that we're working with in New York. So first I'm going to turn to Louise. Louise, take it away. And Kelly, you can go ahead and advance the slide, please.
Thank you, Megan. Yeah, very exciting to hear all of the activity happening in Washington State. I'm going to talk today about a broader look at what Region 10, which is Alaska, Idaho, Oregon, and Washington, and what they've been doing collaboratively to provide mutual support and best practices. So go ahead to the next slide. So this started back with when there was a in-person gathering in 2018 back in Washington, D.C. On healthy aging. And there were both federal partners and state health departments, aging departments who gathered. And at Region 10 HHS, my predecessor, Shelley Zylstra, and OASH Regional Director Renee Bouvion thought it would be a good idea to continue the discussions and have quarterly meetings. So they started convening quarterly meetings. Then, of course, we know COVID hit in spring of 2020. So there was a virtual convening in 2020, and 3 of the states participated and kind of looked at what are some cross-cutting areas that they could focus on, providing some mutual support to each other. And social isolation kind of rose to the top. Individually, the states and had areas where you could see how social isolation had a role, like family caregivers was a concern, a top priority of Idaho. Oregon wanted to focus on age-friendly, and Washington wanted to look at how social determinants of health impact aging policies and how to address that through aging policies. So that's kind of where it happened, where it went. Go ahead to the next slide. But in the meantime, you know, things change over time. The quarterly meetings continued. And what happened was we started to see an interest in kind of a coalescing around Alzheimer's disease and related dementias and what the states were doing there, because a lot was happening at the legislative and policy level. So that kind of became the focus over time. And that kind of incorporated things like social isolation, support for family caregivers, age-friendly communities. So it kind of was kind of cross-cutting in that way. The other thing that happened during this time was COVID and the response to COVID, you know, really brought the aging and public health together because often they're siloed, right? And so that impact, one of the, you know, you could say kind of silver linings was that coalition, that coordination that started to happen. And so hopefully we want to see that continue on. Go ahead to the next slide. So as this, you know, was happening over time, I wanted to highlight kind of some of the ways that public health has had a role and continues to have a role in the state level activity around Alzheimer's disease and related dementias. And the big thing is that it's more and more, and legislators are understanding this too. It's becoming a public health concern, right? It's not just something that, you know, happens in the last couple years of life. It's that recognition of the kind of impact on a family, on people who are working and caregiving, all of that has really gotten the attention of legislators. So states have done some different things. Washington has now 3 state agencies charged to work on dementia support for people living with dementia and their caregivers. So they have the Department of Health, the Department of Social and Health Services, and the Washington Healthcare Authority. So very comprehensive in that way. Idaho just funded in 2021 to have a person housed in the Department of Health and to take a public health approach in their dementia planning, coordinating with the Idaho Commission on Aging, but the lead is at the health department. So again, really seeing that public health response. And then Alaska recently hired a person to work within the Department of Health on Alzheimer's disease and related dementias. All 4 states have plans and roadmaps that have been gone through several versions. I have at the very end, I have links to their state information. Go ahead to the next slide. And so what's happened with the healthy aging work groups is this kind of sharing and focusing on the dementia planning or the roadmaps. And the Healthy Aging Collaborative, the Region 10 Collaborative, provides a space to share ideas and practices. And what's interesting is we always kind of check in and say, do you want to keep meeting? Is this beneficial to you? And by me, I mean myself and Renee Beauvillon at the Office of Assistant Secretary for Health. We always kind of do that feedback, and there's always a real positive, yes, we want to keep meeting because they benefit from the cross state discussions and collaboration. There was the big meeting this February that TIFA sponsored on healthy aging, and the Region 10 participants did their homework, came to the meeting, ready to work. And, so kind of having moved from social isolation to a focus on dementia, we now kind of narrowed it more to there's all these cross-cutting issues that affect people with dementia. The one that everybody kind of settled on that they'd like to share more information and look at some strategies is how to address the challenges with the direct care workforce. That cuts across whether you're a person with dementia, a caregiver, you have other healthcare needs, and you need a direct care worker. So, but we're using the lens of dementia care to look deeper into this issue, and looking at both the shortage of direct care workforce and also the level of training or expertise that direct care workers have in dementia and how to boost that, in particular around the person-centered care, understanding how to approach somebody who is in maybe the deeper stages of Alzheimer's or dementia, and how to work with that person, meeting them where they're at. So that's kind of where we've settled now, and we're doing some environmental scan with the states providing us information on their caregiving workforce requirements, policy strategies. We're going to kind of put that together and see where we go from there. So yeah, it's great to kind of have this continued momentum. So we're just keeping on. Next slide. And I think I'm done. So I have the information here for each state. And I would say their point in time, there, you know, like Alaska says 2021, for instance, but there's ongoing work. So some of the plans don't necessarily get updated annually, but things are always changing. It's pretty dynamic. And so our quarterly meetings kind of help support that dynamic kind of continuous learning and improving approach. And with that, I will close. Thank you.
Thanks so much, Louise. It's so great to hear the ongoing collaboration that's been happening. And I think Region 10 kind of stands out of having those kind of ongoing meetings. But we do appreciate the model that you all brought to that February workshop for all the other state public health leaders and aging agency leaders as well, to really think about how to maintain that ongoing coordination of the work, because that's so important to keep it going.
Yeah, thank you. And I really have to give a lot of credit to Renee Bovion, my counterpart, because she has been the kind of convener and the organizer. And so that's been super helpful. And it's a great partnership within Health and Human Services that we're working across agencies. So thanks.
Absolutely. Absolutely. Thank you. All right. Well, let's go to Kelly Harnish and Kelly Lewis from the Benton Franklin Health District in Washington. Look forward to your sharing. Thank you, ladies.
Thank you so much. I want to just express our appreciation as well for being invited to speak today with all of you. It's a real honor for us to be able to share our region's successes and the work we've been doing that's been really inspired and framed around the age-friendly public health system's 6 Cs. So we can go ahead on to the next slide, please. We're the two Kellys. So just to give you an introduction, Kelly Lewis is the Healthy Aging Public Health Educator. So she coordinates the work of the age-friendly public health systems kind of framework here in Benton and Franklin counties. And I just want to kind of share about her. She really comes from a social work background, and I think that gives her such deep compassion and empathy for our population in a way that, maybe wouldn't be there had she always kind of worked at this population level that she's at now. And I think it gives her just a real skill set to be able to think about the on the ground realities that folks in our community are facing and ways that we can help them from a large viewpoint. So this has been great. It's a new position in our health district, and we're really excited to have it full-time staffed. So that's been wonderful. I'm Kelly Harnish, and I manage the projects in the Healthy Living program, and that includes the Healthy Aging scope. It's been really great for me to get to know the Healthy Aging scope as well. I used to, in college, work with individuals who lived in care facilities, and so I understand kind of that end of the spectrum, but I also spent many years doing health promotion and chronic disease prevention with adults of all ages. And so it's great, again, to be working at this population level with Kelly to see how we can make our community even healthier for individuals as we all are aging. Next slide, please. This is a picture of Benton and Franklin counties, kind of in the Tri-Cities area, and I'll describe our region a little bit. So our jurisdiction from Benton and Franklin Health District really covers 2 counties, which is unique, but also with these 2 counties, this main metropolitan area has 3 cities. And then beyond those 3 cities that are combined as the Tri-Cities, beyond the Tri-Cities, we have a lot of rural community groups, so a lot of rural towns, and there's a lot of diversity as far as what the different parts of Benton and Franklin counties really focus on as far as the activities and what we're known for. So, for example, in the Tri-Cities area, we really have a lot of environmental and energy related workforce. And you can see we're kind of in a desert area, which is not what most people think about Washington, but in Eastern Washington, it's, very dry and kind of desert-like here. And so we have a few small mountains along the sides of the Tri-Cities that provide great walking paths and are pretty accessible for folks of all ability levels. So there's definitely that nice feature of physical activity. We also have the Columbia River. You can kind of see off there a little reflection in the distance, but it's quite big and it flows through the Tri-Cities along with the Snake River and the Yakima River. So there's lots of opportunities for recreation on the waterways, and the water actually provides irrigation for a lot of agriculture. So we grow a lot of fruits and vegetables out here, and even a lot of wineries out here. So if you're ever in our neck of the woods and you're a wine lover, then please visit us. And that's one thing that the Tri-Cities area is very much known for. So I just wanted to give a little sense of where we are and kind of some of the challenges that come with being a health district that covers 2 counties and kind of a diverse population. Next slide, please. Benton and Franklin Health District's mission is that we provide people in our community the opportunity to live full, productive lives by promoting healthy lifestyles, preventing disease and injury, advancing equity, and protecting our environment. And from the equity lens, which is very important to us at the health district, is that we believe everyone in the community should have the opportunity to attain their highest level of health. We value and serve all people regardless of age, race, ethnicity, gender identity, sexual orientation, religion, socioeconomic status, or physical or mental abilities. So those things are just really key in everything that we do throughout all of our departments. We staff over 100 individuals at the health district, and we really cover current and emerging public health concerns like all health departments do. We do everything from environmental health to, injury prevention and performance management. And we have really great partnerships with our community partners, which we'll talk a little bit more about later. Next slide, please. Some of our demographics related to age is that we can see that Benton County, which is more on the west side of the Columbia River, has a little bit of an older population compared to Franklin County. So Benton County, the 25 to 44 bracket is about a quarter of the population. And then when we get to the 45 to 65 plus population, that actually makes up about 42% overall of the population. Whereas in Franklin County, there are a lot more individuals who are children and youth and kind of the younger adult population. So that's one difference between the 2 counties that we keep in mind. Next slide, please. Another, sorry, I think that's not quite the next slide. Just going to break down I think we're looking for slide 6. There we go. I wanted to show the differences between the 2 counties from a racial standpoint. Benton County tends to skew more white, and Franklin County tends to skew more Hispanic overall. And this is for the young and kind of middle-aged adults in our population. And that also is something that we keep in mind with all of our public health messaging and interventions. We do a lot of bilingual communications. And we are also experiencing a real influx of individuals who are migrating from other countries or are refugees. And so we're very fortunate to have staff in our health district who are multilingual to help make sure that that our communications are culturally relevant. Next slide, please. And for our aging adults, the differences racially are less obvious here for the 65 plus population in both counties, primarily are white. So we can see, especially in Franklin County, the Hispanic young population is the primary population. Next slide, please. I'm going to pass this slide to Kelly Lewis to present on our health district's age-friendly public health systems work.
Thank you for the opportunity to share today. About a year ago, Benton Franklin Health District staff were given the opportunity to focus on becoming an age-friendly public health system and to partner with Southeast Washington Aging and Long-Term Care in that endeavor. Next slide, please. Next slide, please. So our key team members from this project included members from Benton Franklin Health District, Carla Prock, our senior manager, Kelly Harnish, who you're hearing today, our healthy living manager, and public health educators, Jessica Garcia, Joselle Prieto, and myself, Kelly Lewis. And from Southeast Washington and Aging Long-Term Care, we had Lori Brown, Executive Director, Leticia Sanchez, Planner, and Jamie Lynn Lewis, Local Program Coordinator. Next slide. This partnership enabled us to coordinate and connect with other agencies and groups throughout our community to address and expand upon work around the age-friendly public health system's 6 Cs. Today, we're focusing on coordinating existing services, exposing gaps in care, and avoiding duplication in an effort to make services available to our Bi-County Health District, including both our urban and rural areas. Next slide, please. In our work in coordinating existing supports and services, we primarily began with the development of a coalition. And I'm sorry, can we go back one slide? I apologize. Early in our, thank you. Early in our project, Benton Franklin Health District staff contacted members of our area's Falls Prevention Coalition. The Falls Prevention Coalition had been active before COVID, but was in more of a holding pattern due to the demand the pandemic had made on all the agencies involved in this particular demographic. Members re-engaged, resulting in discussions that led to the agreement to expand the Falls Prevention Coalition, adding more members and a broadened focus to become what we now know as the Safe and Healthy Aging Coalition. Fall prevention is still a focus and a priority, but we now have a broader scope. So the coalition is set up and open to focusing on other relevant areas related to healthy aging. Next slide, please. Our Safe and Healthy Aging Coalition attendees are from a variety of agencies, groups, and businesses. This slide shows some of the service categories represented within our coalition. A more specific list can be found on our website. We intentionally reflect upon who our coalition members represent and also who might be missing from the table, with a special focus on considering social determinants of health and health equity in an effort to build a diverse and robust group. We have amazing community partners and members who are providing excellent services, but some have been working in silos. The Safe and Healthy Aging Coalition strives to connect service partners, which is incremental, and not only avoiding duplication, but in providing insight to locate gaps in services. Next slide, please. I think that's not quite the slide. Can we go back one slide? Okay. I just wanted to share an example of a current project that involves partners from our coalition. So the Washington State Department of Health, along with Aging and Long-Term Support Administration and the Department of Social and Health Services, provided an opportunity to apply to receive a shipment of wall bars to be installed at in homes at no cost to the recipient. I see the next slide. Let's try one more. I'm sorry, I think we might be missing a slide.
Oh,
If we
I
could just-
apologize. That's my bad. I put them together, so apologies if I missed one.
We could just go back a slide and that's fine. And I'd like to tell you about our project that involved Pasco Fire Department. And we partnered with Pasco Fire and were awarded this grant with Washington Health from the Washington Department of Health. And the project involved installing wall bars or grab bars in the homes of Pasco residents where there was a need. And Pasco Fire follows up with residents they've encountered who appear to be at risk or have experienced a fall. And they'll be providing those wall bars to those in need with a focus on low income households with individuals that have a family member over the age of 60, rural locations, veterans, people with disabilities, and households with limited English proficiency. Our Safe and Healthy Aging partners are aware of this service and can make referrals to assist in identifying who might need this service. So Pasco Fire is able to serve those who they may not have encountered themselves on a call, but have also been referred by our community partners. And I will move on. I think Kelly was going to take this particular slide.
Thank you. And sorry for all the switching. You're doing a great job keeping up with us. Can you go back one slide? That one was where I was going to pick up, and I think there was just something missing from right before that, and that's okay. So I did want to talk about where the Safe and Healthy Aging Coalition fits within the larger community viewpoint of coalitions. Down at the bottom, you see Benton and Franklin Community Health Alliance, and that's kind of our umbrella agency, or has been for a long time, where a lot of these topic-focused coalitions have been housed. Safe and Healthy Aging Coalition, as Kelly Lewis mentioned, was something that came from that false prevention coalition and is now refreshed and really has been made to be so much more robust. Also within the Benton Franklin Community Health Alliance, we have the Tri-Cities Mobility Action Group, which I'll talk a little bit more about as it relates to aging. Health Equity and Access Team. Again, all of these have some element that really promote healthy aging in our community. Food Access and Security Coalition, the Oral Health Coalition, and the Community of Hope Coalition, which is another framework that we follow here at the Health District. And the Benton Franklin Health, Behavioral Health Committee, excuse me, so many Benton Franklins. And then again, the Benton Franklin Community Health Alliance as our umbrella agency. Next slide, please. I'll show the relationship between our healthy aging work and this other coalition, the Tri-Cities Mobility Action Group. This is a group that started last year and aims to help all residents of the Tri-Cities be active and safe in everyday living through policy, systems, and environmental supports. We really look at equitable and inclusive and sustainable supports. We want to make this being a place where the built environment has easy opportunities for everyone of all levels to be mobile and active. So some of the work that we've done over the past year is to really build our partnerships with the municipalities and local elected officials. We have currently our Metropolitan Planning Organization in this group. We have Southeast Washington Aging and Long-Term Care, the city of Pasco, and we're trying to expand our membership to include all the other cities of the Tri-Cities, but we've had excellent partnership with the city of Pasco. Really, really great to be able to work with them, specifically their planning manager, who has really progressive ideas about how to create mobility access for everyone. We've also worked with our local transit office, and we have two members from that office. One of them is the ADA compliance manager at the Benton Franklin Transit office. So that's been an excellent partnership as well. And as I mentioned, we've brought in at least one elected official, occasionally two, and we're working on more. And we've brought news media into our meetings and events as well. One of the activities that we do through this Tri-Cities Mobility Action Group is run quarterly walk audits. We've currently completed 2 walk audits. The first was a pilot project to make sure that our checklists and our methods were all good. And then we moved to the second one and really became more systematic about that. And those walk audits really give our group an opportunity to get on the ground and look at a focused area to see where there may be things that either enhance or inhibit mobility for different folks in our community. And we really are looking at where those barriers may be for, say, parents pushing a stroller or people who are visually impaired and trying to navigate that particular area. And we've found some really great information and started to formalize a process that we can take that report out to the jurisdiction where we look. So we've done one in Richland and one in Pasco. And then in the summer, we'll do one in Kennewick, which is the third of the Tri-Cities. So really excited about that. It gives us an opportunity to provide something tangible and some tangible recommendations. Next slide, please. This is a little infographic that ties together that mobility concept with the equity frame that we keep here at the Health District. Obviously, being able to cross a street with a crosswalk and a yield sign is better than nothing, but we know it's not good enough. And so with the equity framework, everyone here in this group gets what they need. There are audio sounds to help navigate the street crossing. There's a ramp to make it easier to get on and off the street. And there are, lights to show the child that it's safe to cross or to not cross. And so that really brings a level of equity and really being able to provide that opportunity for people of all ages and ability levels to remain active, because we know physical activity is so important for our physical health in preventing chronic disease and injury, but it's also so important for our mental health and social connectedness. So that's something we're really striving towards in our community. Next slide, please. And we also think about how our coordination of the healthy aging work we do is informed by data. The timing of moving into a full-time position for healthy aging really was great because we just completed a community health needs assessment. We're on a 3-year cycle. And so 2022 was our community health needs assessment. And this year we're releasing our community health improvement plan. And we've been really fortunate with our additional staffing in both in CHIP coordinating and in healthy aging that we've been able to look at our CHIP, our community health improvement plan, and look at our data and see how the coalition, the Safe and Healthy Aging Coalition, can pull from that information and create strategies that are team focused, where all of these different partnerships from different entities are able to kind of overlap services and resources to address the needs that were identified and work in a coordinated way. So we're really excited about the timing of all of that. It couldn't have been better. From the data we found, the 4 priority areas that we're focusing on in the CHIP include behavioral health, housing and homelessness needs, access to health, which includes what we talked about earlier with mobility, not just healthcare, but all the things that we need in order to remain healthy in our communities, and then community partnership development. And within each of those 4 priority areas, we've identified something that really promotes healthy aging. So we've made sure to include this concept throughout our work. And next slide, please.
I just want to say, Kelly, I'm just, I love that you have been able to incorporate healthy aging into every one of those priorities for your CHIP. That's just revolutionary. So congratulations.
Thank you so much, Megan. We're excited about it. And again, it's just a real, I think we're just so lucky to have such great staff here that can look at these opportunities to weave our services and our work together. Thank you. And with that, I'm going to give it to Kelly Lewis to close up our presentation today.
Thank you. So we also coordinate existing services through an emphasis on communication, utilizing direct conversations, social media, and our Benton Franklin Health District website. We have a website page dedicated directly to healthy aging, and also another page specifically for our Safe and Healthy Aging Coalition. Links to community service partners and educational information are available through our website and social media platforms for a variety of relevant topics that are relevant to healthy aging. We strive to present information in a manner that provides a positive outlook toward healthy aging for adults of all ages and their loved ones. We include an educational component during our monthly coalition meetings with a highlight and a link to the recent age-friendly public health systems trainings. Next slide, please. Wanted to talk just a bit about some of our next steps as we proceed. We want to continue to have an emphasis on our Safe and Healthy Aging Coalition that's aligned with the age-friendly public health systems goals. We also strive to align much of our work with our current Benton Franklin Community Health Improvement Plan. We'll continue to focus on building new partnerships and maintaining the connections that we have within our community already. We regularly update and provide new social media and website content. And we also happily participate in outreach events and make sure that we post those and try to let our community partners know of these event opportunities. Next slide, please. So thank you so very much for inviting us to present today. We are appreciative of the age-friendly public health systems, and we look forward to how this work will continue to provide a positive impact within our community.
Awesome, awesome work. I'm so excited about this. So Kaylee, let's take down the slide deck for now so we can do some Q&A and see each other. If you have questions, go ahead and use the virtual raise hand function and come off mute, and we'll call on you. I didn't really see any questions in the chat. I do want to ask Kelly and Kelly, you have so many great partners, right? And it looks like you've worked really hard to create those partnerships. What would you say to someone who's just starting this work? How do you identify those partners? Like, where did you go to figure out who you needed to bring in to your coalitions?
I can start, and Kelly, if you have anything to add from the Healthy Aging Coalition, please speak up on that. But we were both very fortunate to not have to create this from scratch. So I can't speak to the challenges that would be faced if doing that. We've had, as we both entered this work at the health district, we came in with active coalitions. The one thing that has been a challenge that we're addressing is really getting coalition focus, and that's what our real effort is placed around. And I think we've made some good headway as to make our coalition meetings structured and as I mentioned earlier, everybody being on the same page for the same goals and objectives, and we're seeing some real progress in that area. What we've noticed previous to some of that kind of structural and organized approach was a great opportunity to come and share out about services and events and resources that are available, but not a lot of strategic planning. So that's where where we're really kind of honed in on is trying to help with the strategic planning aspect. It has been very beneficial that the Benton Franklin Community Health Alliance has been in existence for as long as it has. It really has provided that place for people to go if they have, a question or need to partner with another agency. They can go to those meetings. And I would also say, from my understanding, the switch from in-person meetings pre-COVID to the virtual platforms during COVID really brought a lot of accessibility to people to be able to attend those coalition meetings. But so I would say from advice, I would start with a list of sectors first, and we'd be happy to share our list of sectors for healthy aging or any of those other coalitions. And from there, start reaching out to people. Don't be afraid to make cold calls and introduce yourself and the purpose of your work and why you're calling. And from there, it really starts to build. It does take time, but people are always willing to lend a hand, or to say, you know, I may not be the right person for this, but I do know somebody who I can connect you with. We've had good luck with that in other groups that we're forming.
That's great advice. And yes, to Marion, the slides will be sent to everyone who registered, as well as a link to the recording of this session that we will send out. And please feel free to share widely. We're happy for you to forward this on to others. Louise, you have your hand up.
Yeah, just to piggyback on what Kelly and Kelly just presented on, this is like a perfect example of the aging network that ACL funds. So Administration for Community Living has within it our Older Americans Act programs. And we give grants to states such as Washington Aging and Long-Term Supports Administration, who then in turn fund our area agencies on aging, such as Southeast Washington Aging and Long-Term Care. So at the local level, you see that really powerful work being done between public health and the aging network. And it's just a great example. And for those of you who are not sure where to go to find, say, your aging cohorts, you could, I put the ACL website in the chat. You could start there. You could start at the Elder Care Locator. If you do eldercarelocator.org, you will find, you can get to your local area agency on aging. So just a couple thoughts there. Also, if you Googled Aging and Disability Resource Center in your state, that could be another way. So just wanted to add that. Thank you.
Thanks, Louise. And I will also add that thanks to our funding from the John A. Hartford Foundation, we are building a map, an age-friendly ecosystem map on the age-friendly public health system AFPHS.org website that will provide links to the public health departments and the main public health department in the State Department of Health in every state, but it also will provide information on those AAAs. So every planning service area, there will be a link. Every age-friendly hospital, there will be a link to each hospital. So what we're hoping to do is really enhance the opportunity for that kind of cross-sector collaboration within the age-friendly ecosystem. Also age-friendly communities, which provide great services and help to connect people as well. Any other questions that we have? Because I always have questions. You guys know that I always have questions, but I want to give others an opportunity. Jane.
I was trying to put my hand up, but I was just getting claps, I think, but claps are well deserved. Megan, what is the thought, and Louise as well, great, all of you, great information. What's the thought about at one of the most recent TIFA's National Learning Collaborative had mentioned that possibly the multi-sector planning for aging is maybe a great way to kind of pull together, you know, AAAs and public health. And I just wondered, Louise, any thoughts that you might have, or anyone thought you might have on the MPA initiatives going on around the country?
Louise, do you have any response to that?
No big response other than it sounds like that's a good direction to go. Yeah. So
yeah. I mean, it's you know, these are very state focused planning opportunities, I think, and so they are being led in some states by the Department of Health, but in some states it's the Department of Aging, or it's a coalition of other agencies, and there does need to be, you know, that kind of buy-in from a governor's office or some kind of leadership, I think, as well, because these are very policy focused,
right.
The multi-sector plans for aging. So there's definitely an opportunity for public health to come in and definitely to be at that table.
Yeah, absolutely. And I think that you also hit on that support from the governor's office or legislative committees that focus on health and long-term care. Eventually it does get into the, how do you get it into your state law eventually, and how do you really make it that, that real and focused? So
That's why there's been some discussion about, and maybe ACL is the place to do that, to create some sort of a national MPA, National Multi-Sector Plan for Aging, that the states could be a model for the states. Anyway, that's just the initial conversations, but thanks, Liz.
Yeah, I love that idea, Jane. Because even in a conversation I was in yesterday about potentially doing some kind of a national meeting, there was a lack of awareness of all the different federal agencies even that touch on the older adult population. I think that happens at every level of government. And so it's really important to have our eyes opened and have the model that Benton Franklin has provided us here today. Really, really great work. Other questions, comments? Well, go ahead, Louise.
Just kind of off the cuff thinking around that the whole age friendly. It often does seem to start at a very local level, a county, a city, and trying to branch that out to state, really does take that whole other level of engagement. But also I think that the states that are working on their strategic plans around dementia care, there's a lot to learn from that model around age friendly.
There also is a lot more money attached to dementia care and Alzheimer's than there is to healthy aging more broadly. And so we'd like to see that the model of Alzheimer's and dementia expanded to the whole person, right? Whole person care, I think is what we're really talking about.
Yeah. And I would also add that, there's healthy aging. People often, as they age, have disabilities, but also the perspective of younger people with disabilities who use long-term services and supports. Involvement of their opinion as they age, I think would also be important in this, if you're getting really broad there. But for instance, some persons with Down syndrome later go on to develop a form of dementia at a younger age. So there's just, there's a lot that can be done and a lot that can be learned from, say, the persons of a younger age with disabilities around accessibility, advocacy. So I think there's a lot of wisdom and experience there that could benefit this whole endeavor. So
absolutely. So I had a question for Kelly and Kelly, and it's about data. This is an area that we promote, how important it is to have data. So I wonder if you could speak to how important it was to have access to data on the older adult population in Benton County and Franklin County, to bring partners along, right? To educate them and engage them in some of the coalition work that you all are now doing.
Thank you. Yes, that's been definitely an exciting asset to have as we've worked with our coalitions. A couple of data points that I think have come as a surprise, and sometimes those surprise data points help get that engagement, help people focus on, hey, what do we really need to do with this work and with this population? So one area that we found in our community health needs assessment was the life expectancy disparity between zip codes. We saw a greater than 10-year life expectancy disparity between a zip code in kind of the southern part of our region compared to a part of our region that's within city limits of Kennewick. And that's, eye-opening to understand what social determinants of health are happening in that particular zip code that is causing such a big difference. So that's something we're going to continue to look at. We have also recently hired an equity policy analyst at the health district. Awesome. And so with her plus our data specialists here, we have 3 epidemiologists that, is an area that I would like to see explored a little bit more, where that discrepancy, where it's coming from. Another kind of information, sharing that we are really framing our messaging around is positive community norms. And one of the things that we can do with positive community norms is make sure that the perceptions are accurate. We just attended a training last week, which was really great. And I loved one of the quotes they said was, misperception is a risk factor, but accurate perception is a protective factor. And so what we can do as a community is have accurate perceptions of need. And a focused area that I can use as an example for that is we are seeing that our 65 plus population that has the highest rates of suicide compared to other age populations in our counties. And the perception happens to be that the highest risk population is our youth, because of course we're concerned about our youth. And but that's a misperception. It is really our 65 plus population that is higher risk. And so I think by expressing the data accurately and making sure that people are on the same page, we can focus our work better. And so that's just kind of some of the examples of ways we've used the data.
Yeah, that's really eye-opening, I think. Very interesting. Any other questions? All right, well, we're still open to questions while we wrap up here. So if anybody thinks of something, please either go off mute and interrupt me or raise your hand. And as we're bringing these slides back up, I just want to remind everyone of our training next month. We'll focus on we'll continue to be on our 6 C's framework, but will not be on coordinating. Sorry, we didn't get that updated. It will either be on data or it might be on complementing services. We are going to focus on Mental Health Awareness Month, and we'll be bringing in some really interesting programs that we've identified, some really bright spots around the country in addressing mental health issues among the older adult population. So please join us again next month, the third Thursday, which is May 18th at 3 p.m. And next slide, please. So for those of you who are viewing the recording of this presentation at a later date other than April 20th, 2023, you will have the opportunity to click on a link in the right-hand corner, or you can pause the recording and complete the survey the link of which you see at the bottom of the screen. And so, there's one more question coming in our last couple of minutes here. So what about funding for this work? So much of local public health is tied to funding. So I don't know if Kelly or Louise, I know that you guys fund AAAs, but we're wondering about like the public health funding and how that has happened in Benton Franklin.
In Benton Franklin, we've been just extremely fortunate. Our manager, Kelly Lewis, and manager Carla Prock, who many of you probably know, she worked really hard to get foundational public health funds to Benton Franklin Health District. And so that's how I have a new position, Kelly Lewis has a new position, and then the equity position that was created in addition to another epidemiologist who focuses on assessment. So those are 4 examples. There's a few more new positions that were funded by foundational public health funds. And so that's been really exciting to be able to kind of see the best practices that have been looked at for so long, be able to actually have people dedicated to do that work. And we do a lot of grant fund applications as well, and get funding through the Department of Health.
Great, thank you. Louise, did you want to respond as well?
Just that the grants that the states get from ACL, there's specific areas, congregate meals, home delivered meals, but there's a lot of flexibility. And so things like age-friendly, emergency preparation and response, other kinds of things can be kind of woven into those the state priorities, and then that goes on to the AAA area agency on aging priorities. So there's some flexibility in terms of maybe allocating staff resources would be a primary way. But then I also think that part of the goal of the Older Americans Act is for those area agencies to also engage with the local community and build other sources of funding, whether it's through grants or county contributions, things like that. So.
Absolutely. Absolutely. Well, we are at time. Thank you all so much for your attention all the way up to the end. Louise, Kelly, and Kelly, thank you so much for all the work that you're doing, first of all, but for joining us here today as well. The information that you have shared is just invaluable. I know that many people will be viewing the recording of this, and we urge everyone to go ahead and share that recording as we send it out. So thank you all so much, and hope you will join us again next month.
Thank you.
Thank you.
Thank you. We can stop the recording.